How do you fix when your patient comes in with breast implants that are separated like hers? Well, my beautiful 41-year-old patient came to see me because she was unhappy with the appearance of her breasts. 17 years ago, she underwent a breast augmentation by a different plastic surgeon where large saline implants were placed through her armpits and underneath her pectoralis major muscles. Now, there are 4 different ways that you can place a breast implant into the breast. The most common way is using a small incision underneath the breast. Second most common is an incision around the areola, followed by the armpit approach, which is what this patient had, and then the transumbilical approach, which is called the tuba. That's where you make an incision in the belly button and somehow get the implant into the breast. Now in this operation, an incision is then made in the armpit, and then typically a plastic surgeon uses a blunt dissector like this one to essentially tear open a pocket to put the implant in. Now some surgeons use endoscopy where they can actually see what's going on the inside. Other surgeons don't, and they literally just tear open a pocket and stuff an implant in. Now the problem in this patient's case is that her chest muscles, her pectoralis major muscles, attach to the sides of her sternum, not in the middle, and this can cause the implants to look excessively far apart. And so when they're under the muscle and they're spread apart like this, and the patient then flexes her muscles, you can see those implants being pushed even farther apart, and that's what she really didn't like. And on top of that, the pocket that the surgeon made was huge. It extended all the way from the bottom of the breast all the way actually into the armpit. And you can see here, this is a video from me in the operating room actually squeezing her breast implant all the way up into her armpit. And she told me that at times it could actually get stuck up there. Now my beautiful patient's main concerns were that her implants were too big and they were excessively spaced apart. And so she wanted to go smaller with her implants, and my concern was that if we kept that same pocket underneath the muscle, a smaller implant would be even more likely to get stuck up in her armpit. So in order to fix this, I did a site change. So here are her markings for the operation, and you can see that there is a mark on the lower surface of her breast, and that is where her current implant pockets lie. Then there's a marking above that, and that's where I want to move her pocket to so that the pocket is more centralized and it's significantly smaller. Now in order to do this, I would have to make a new pocket above the muscle, and that's why we call the site change. You're changing from below the muscle to above the muscle. So by making a brand new breast implant pocket according to the exact marks and size I want it to be, she can have a more centralized breast implant and one that doesn't migrate and get stuck up in her armpits. Now the main knock and concern on putting implants above the muscle is that they may have a higher rate of capsular contracture. And this is excess scar tissue that can build up around the implant. Studies show that putting the implants below the muscle has a lower rate of capsular contracture than going above the muscle. And so because of that, most of the time I do place my patient's implants underneath the muscle. But in this patient's case, going underneath the muscle caused her a lot of problems. And so going above the muscle made the most sense. And in order to decrease her risk of capsular contracture, we're going to use the newest generation of silicone breast implants. Studies show that these implants have a lower rate of capsular contracture, as low as 0.5%. So that way I can feel confident that she's going to have a new breast implant pocket that puts her implants exactly where she wants them to be, but does not hopefully create that risk of a capsular contracture. And this is how she looked like after the 2.5-hour operation. You can see her implants are more centralized, they're not way out to the side anymore, and they are exactly the size that this patient wants. Well, it's been 2.5 weeks after my patient's surgery, and here is how she's doing. As you can see, her new breast pockets are continuing to hold very nicely. She's definitely swollen, and the shape is going to continue to change and hopefully look better and better as time goes on. I'm really excited to show you how she looks in a few months from now as she gets her final result. One big part of my practice is helping fix up breasts that have been botched from previous plastic surgery. And one recent patient had her breasts so botched that she had fat grafting to her breasts as a way to enhance them, and the doctor was having her use duct tape to try to hold them up. How did I fix her up? Take a peek at this video right up here, and as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.